I'm Dr. Hemal Mehta. I'm here today with Dr. Ramon Coronado. We're going to discuss regenerative medicine and stem cells and a whole different aspects of regenerative medicine.
I am Ramon Coronado. I'm a doctor, not MD, but PhD in biomedical engineering. And I've been working with regenerative medicine, cell therapeutics for over 15 years now.
And one of the things that I think is important is I'm bringing it from the clinical aspect. He's bringing it from the research and science aspect. And I think the mesh is amazing because that's what it really takes to provide good care to a patient and provide care for regenerative medicine is kind of this combination.
Yeah, I think that the way the science is working right now and the medicine in general is you have a different, it's very complex.
Right.
So, and the complexity comes from the research, discovery, all the way to how do you manufacture, how to make products, how do you apply them into the clinic. Like traditionally, you have big pharma going 10 years from a discovery and billions of dollars to get it to a patient to help them out. And the way that the world is working right now is like we need a lot of people trying to move things faster. And in order to make the whole bridge from discovery to helping a patient, you have to speak different languages.
Right.
And there's an aspect of languages that comes from the science, regulatory, biomanufacturing, and another component of the language is the clinical application, the experience with the patients, guiding them. But also the part that you are experiencing a lot is now patients are coming to you with some answers on their hands. Research papers, AI is bringing a lot of information. So now you're dealing with a population that is well informed compared to 5 years ago where they're just blindly accepting what doctors were asking.
Right. Yeah, you're right. And that's one of the things that I find. I know and I've seen what works in clinical practice, but knowing the science behind that, I think is extremely important too, because that helps me when I'm explaining things to patients. They will come in with already these generated AI papers saying that, hey, I want to try this or try that for my knee because I think this will work. And they have the answers a lot of the times. So it's important to know the science from that, not just that perspective, but knowing what's going to work for a patient too. And it's the wild, wild west, right? Mm-hmm. The regenerative medicine. So what we need to do is be innovative and figure out what may work for one person may not work for another person. In order to do that, you need to know the science and the research behind it.
Well, I think that I feel it's phenomenal that patients are coming to you with a sort of an idea what it's available. And like any other drug, when they come to you, it gives you the opportunity to talk to them about it and educate them and help them out. But the other part of it is how do you have a medicine and how to apply it to their indication? So your expertise guides them to when a drug is useful for when, at what dosage, how often, and what the expectations can be.
Right.
So I feel like the AI is at least opening the conversation.
Right.
And then it gives the opportunity for you to talk with experience.
Right.
And say, okay, I've used all these different tools. Which tool is better for you? When, how to get a better outcome that you have?
Right. Yeah, that's one of the questions I get asked a lot too is like secretomes and exosomes and what's better? Is it better to use one over the other? There's a lot of confusion and they don't always know the answer. You know, sometimes patients believe they know the answer. Can you explain a little bit about the difference between secretomes?
Yeah, and I think it's important to talk a little bit about the history of regenerative medicine. So the origins of regenerative medicine were fundamentally based on cell therapeutics, living cells. And I like to explain cells as a fruit. Let's take an orange. Right. So people were needing certain nutrients from the orange, and they will have and eat the entire orange. And then that was working very well. There's a lot of clinical trials using living cells. There's an approved mesenchymal stem cell product right now on the market. And then the science kept advancing into, okay, if the cells can do it, what is it about the cells that are making this happen? So what we end up doing is squeezing the juice out of it. And we start using the juice, and we're like, okay, this actually has a lot of therapeutic effect. So instead of using a living orange, we were using the juice out of it, which is essentially what you find as what is called a secretome.
Right.
So what is interesting is when you get the juice, you get it with pulp.
Right.
And then there was an environment in which we were investigating, is the pulp all you need? And that's what I will equate to exosomes.
Okay.
So if I take this little pulp and I use it, does it work in a therapeutic effect? And we have that through animal models and in vitro and the laboratory. So we took the pulp and we have an effect.
Right.
And for the longest time, I was like, oh, the pulp is the best thing you can do.
Right.
But then in order to do those experiments and really be scientifically mindful of the experiments, we also had to take what it was left behind,
right,
and put it on the model.
Right.
And what we were leaving behind was also very therapeutic.
Wow.
So it kind of reverted back into like, okay, why are we only using the pulp when the entire juice is doing a better therapeutic effect? So that's how I would equate the orange fruit, the juice with pulp, and the pulp alone as the stem cells, the secretome, and the exosomes.
Got it.
So I'm more in the science that I'm doing right now. I'm more focused on the secretome because it's a more broad spectrum.
Right.
It has the vesicles within the secretome. You have also vesicles like exosomes, but you also have growth factors. You have other cytokines and things that are useful,
right,
in having therapeutic effect, more matching the behavior of the mesenchymal cells.
Right, and that makes sense. It's like a combination of the juice and the pulp, which is the exosomes, and the growth factors, which make up basically the secretomes, which would seem to me be a better product than just exosomes alone.
Well, yeah, I think we show that in vitro where exosomes alone, at least for the MSCs directly, it seems to having a more therapeutic effect, a more broad spectrum. Now, what is interesting too is like there's some exosome for diagnosis. Mm-hmm. Some people can take exosomes from your blood and then take those and evaluate. That's a whole different technology. And I like to also tell people the exosomes are like a capsule. It's a physical capsule. It's a little bubble that has information inside. And one of the issues in the market that I've seen is people talk about exosomes by the amounts of exosomes. So I have more exosomes as the other one. I have 20 billion capsules versus 5 billion capsules. And something to be mindful of is the capsule does not determine the therapeutic effect. It's what's inside of the capsule. It's like saying you have 20 capsules versus 5 capsules, but the 20 are empty or they don't have it. So the products are different. And then the simplistic way where we started working with exosomes was just to quantify them. How many do we have? But it has advanced to the point that we need to also understand what's in them, right? And what are the components that you have.
So it's not necessarily the amount, right? But more the quality.
Correct.
Right. Not quantity, but quality.
Correct. I think that the therapeutics in regenerative medicine, quality is becoming more important than quantity.
Yes, I agree. And that's something that we always get asked is, how many stem cells am I getting? How many of exosomes am I getting? Am I getting billions? When they don't really need the high numbers. They just need the good quality ones.
Correct. And I think it has to do with the history of it, right? So it started because in science, we only knew how to detect certain amounts. Mm-hmm. And eventually start moving to, okay, where's the quality? What is the origin? And then where we see it right now, the quality is way more important than the quantity. And you can extrapolate this to many things in life, right?
Right, exactly. Well, so the secretomes, you can actually use them in combination with stem cells too.
Yeah, absolutely. So if you think about it, the secretomes are produced by the cells. Mm-hmm. And then that's the environment where they feel the best.
Right.
So when you get a stem cell and you give them an environment that they feel familiar with, mm-hmm. they're going to behave more in their environment to perform better. And it's like for example, if you take me to where I live and I have my environment, I can perform better. I'm familiar with it. Right. And I'm not stressing myself out into figure out how to transition from one area to the other one.
That makes sense. It's almost like a fertilizer too for stem cells, right? That makes sense. And then as far as autologous and allogeneic, autologous cells comes from the patient themselves, where the allogeneic cells are donated. Now, I get questions a lot about, are they safe? Are allogeneic cells safe? Can you take it from one place and put it into someone else? Do you have to match them? The safety aspect of it. Can you comment on that?
Yeah, absolutely. So I think that there's multiple things that we need to cover when it talks about autologous versus allogeneic. The benefits, there's pros and there's cons. And then I think from the safety point of view, autologous is usually safer in the way that is your own cells. But as you can imagine, the quality of your cells, their age, or not performing to begin with, then is that going to give you the opportunity to heal the best you can? Are you essentially leveraging your own system, in many cases, your age-old system, into fixing something that has not been able to fix by itself? So you have some components of, okay, what risk am I taking? Is it safer? And what benefits do I get out of it? Similar to plasma or PRP, your own components, as you age, the quality of the product decreases. The allogeneic component, it has, depending how it's manufactured and tested, you can have a very safe aspect of it. For example, you can have, the FDA requires extreme depth of testing for dormant viruses, for chromosomal abnormalities. So if you can make sure and you have a good manufacturing system, the safety gets into a very good way. Now, think about, for example, there's an FDA-approved mesenchymal stem cell, and then that is given to children. They have a very severe disease called acute graft-versus-host disease that does not respond to any steroids. So now they go on top of that and put MSCs. So do you think the FDA will approve MSC product that is not safe? Not the case. So there's the safety component from allogeneic can be mitigated or can be controlled by how you manufacture it. That's why you, as a physician, you have to rely on partners and people who can provide safety documentation saying that this is a very safe source. What happens with people that are cutting corners, or they don't know too much about biomanufacturing, they make products that could be not as safe. So the safe benefits starts tilting towards not worth it.
And that's one of the benefits. There is a law recently passed in the state of Tennessee, and I think only 4 states now have this law, Florida, Tennessee, Texas, and Utah, that ensures wherever the physician is getting their product from, they're going through that manufacturing process to keep it safe. And that's one of the reasons we work with your company, because you guys have that outstanding ability to do that, to make sure that the product is a very safe product.
Correct. There's a standard, we call it pharma grade, but essentially what it is called GMP, good manufacturing procedures, that you have to have a standard of clinical approval that guarantees the safety. Another thing to talk about allogeneic, we talk about the safety aspect, but then what is the benefit of it, right? So I like to say, you want to have the healing capabilities of a baby, or you want to have a healing capabilities of yourself. And then in most of the times, I think when we leverage the healing capabilities of a younger individual, you can see why. Like the kids rarely scar. They are pretty much good to go after the script they need. The next day they're fine. I have 2 little kids, and then they don't get bothered by a cut. For me, it takes me like 3 weeks to recover from that cut. So we're leveraging that healing capability from a younger individual into an adult. And that's why the benefits of allogeneic. The allogeneic gives you 2 components. One of them is ease of use. The procedures can be done at the same time. Autologous usually is 2 visits, one big extract or longer procedures. It gives you the capability of testing the product. You have consistency, that the potency is there. And deep testing allows you to do that, but also gives you the healing capabilities of the potency of a younger individual, which is extremely beneficial in a lot of cases.
Yeah, I agree. And in clinical practice and doing regenerative medicine for the last 10 years, I've used both autologous and allogeneic products. And I've always seen a better outcome with allogeneic products. And you're right, it's the ease of using it is so much easier, so much more convenient. When you have to extract bone marrow out of a patient or do an adipose harvest, it's an extra procedure that the patient has to go through, and it's an extra risk as well. So this makes the whole process significantly easier and more comfortable for the patient.
Well, I mean, your patients are lucky to have you to navigate them through that, right? One of the things that we've seen is you want to be working with doctors as a patient. They have multiple tools, because now they're not forcing one only tool that they have. And then they have the capability of just helping and guiding you into going through the process and guide you to what's best for you based on your circumstances, your expected outcomes, and honestly, your cost access to it too. and the opportunities that you provide as a physician, when you have multiple tools, it puts patients in a better place to get the better outcomes possible. So what you're doing is extremely important into recognizing which tool. And I love the fact that you have worked with all different modalities, because it gives me the confidence that you will treat patients fairly and it will give them the best possible outcome.
Right. And thank you. I appreciate you saying that. But honestly, I couldn't do it without you doing what you do on your end.
Well, we complement each other.
Yeah, exactly. Exactly. It really does. And I think that's why it's important to be working together with a group like yours, because I want to make sure that we're using science to figure out the best product for our patients, to be able to give them the best product and have the best outcomes.
Yeah. And the other part is like science evolves.
Yes,
right? What is
right.
the best today might change in a year.
Right.
And we continuously work on the science to see what is the next evolution of these treatments. I mean, we're talking about many other modalities that are being done outside of the country, many modalities that are going through clinical trials or the scientific side. So it's good to always, to your point of having that complement, working with each other, is that you're always going to have access in seeing what's coming next.
Right.
So you don't leave your patients into what it was done 10 years ago,
Right.
and that's all you do.
Right.
So I think it's important to have a progressive place that takes care of the patients, not only with multiple modalities, but always keeping your eyes in the horizon to what's coming next.
Right. And because there's so many conditions that this can treat too, not just back pain or osteoarthritis. We've been treating things from things like autism to traumatic brain injuries. And the treatment aspect is just growing. I think what we're going to be able to treat in the future with the research that you guys are doing is just going to be phenomenal.
Yeah, I mean, it's an exciting future. I can tell you that much. I think that our understanding of disease, that includes aging,
right,
and then the genetic components are involved into how do you function better. Right. Because now we're having a way of understanding that it's not only for the people who have diseases, but it's like, if I'm healthy, how can I keep my health? Right. How can I keep performing? I like to work out during the weekends. Right. I want to keep recovering from this, so I can keep doing it. Like I mentioned, I have 2 little kids. I want to have the energy to play with them. But then my goal is to have my great-grandkids and play with them too. Right. So how can I increase my potential of health span? Not only the amount of years I'm going to live, but can I keep my effective functionality?
Right. The quality of
the quality. Yeah. Keep that quality of life for as long as I can.
Right.
I think that's ultimately what we are trying to research and trying to come up with. Right. Where hopefully we just get to the point where we can live many, many years at a very high quality of life.
Right. And it sounds like you guys have a subjective way of measuring biological age and being able to look at the biological age and see the difference after being treated, and seeing improvements in biological ages.
Correct. So there's a fascinating new realm of technology that is integrating with regenerative medicine, which is longevity, the longevity science. And one of the beautiful tools that we have to borrow from the scientific literature is with a blood test, a simple blood test. Now I can measure your biological age. And then now we're just not guessing into like, are you getting better? Are you getting younger? This is functionally getting you to a better place,
right?
Especially as a healthy individual, right, that you think, well, I don't have any disease.
Right.
How do I keep this going on? So now we have an opportunity to measure biological age in a simple way. And now we can keep track of that number,
right,
and have interventions that help you guide that. Right. Now we have a closed loop of information where you go to a physician and they can help you not only to stay where you're at, but can I improve my baseline?
Right.
So for example, if I'm like minus 10 years from my chronological age, can I make it even further, or can I keep it there? Can I keep that gap so before any disease shows up?
Right. And that is very interesting. I think that aspect of science is so new. Where you're on the forefront of the research of that. And we're hoping to be able to translate into some clinical practice as well, because I think clinically it would be wonderful for patients to be able to see that, hey, what they're doing, their treatments is actually working. It's actually making them younger, so to speak.
Correct. And then this is not just data that we're putting into like a biological age as a gimmick. A lot of people don't understand that these clocks are being validated, mortality risk with cohorts of hundreds of thousands of people, when they can go look back into the medical records and they can see, okay, when did they die based on this? And they fit it into an equation that actually predicts your mortality risk.
Right.
So what are the chances of you dying in the next 10 years?
Right.
And then that ties in with your biological age. So now, and this is fascinating because it's very recent.
Right.
It was not until probably 20 years ago when we couldn't measure age. So age was like the weather.
Right.
When you just age, and you just have different clothes, and then you just show up for it, right?
Right.
We couldn't, like back in the days, you could imagine someone talking about predicting the weather. It was like, you're crazy.
Right.
So that mystical component of aging changed fundamentally with a big researcher, Dr. Horvath, was able to measure objectively what age is. And now you can have twins, and then even though they're chronological the same age, you can take blood tests and quantify who's actually younger or older.
Wow.
And now that we have that capability of detection and validation to make sure that that number is meaningful,
Wow.
now you can have interventions around that. And that gives you the capability as a physician to track that and evaluate, enhance. And now to talk about performance, not only about, hey, you have a disease, let me revert it. It's like, no, let's enhance your performance so you don't develop these diseases later on. And this is available right now because the science and the opportunity of knowledge allows us to be living this fabulous time in history.
Right.
For the first time in humanity, not only we can measure age, but then there's new science coming up. There was someone at FDA there's a clinical trial sanctioned by the FDA where they got treated for reverting age.
Wow.
And the ability to do that is to restore function. In this case was for blind people, to restore vision by just moving the clock back. So not only we can measure things, but now we have learned tools that can accelerate, decelerate, or stop aging.
Wow. And you've seen that in clinically.
Yeah.
You can see the improvements clinically in these patients.
So there's things that can be done clinically. So we have done that in many animal models.
Wow.
From worms to mice, to rats, to larger animals.
Wow.
But it's fundamentally changing how we think about health and medicine.
I think that's fascinating. And I think it's only going to get better and better from this point.
Absolutely. So some of the things that we say is like, don't die in the next 10 years and you're probably going to get to 120 years old. But that's what we're trying to understand scientifically and bring tools to translate so people can benefit from these technologies.
So one question I get asked a lot too is, they're doing this all over the world, everywhere, right? Why should a patient stay in the United States? Why is it okay for them to stay in the United States versus going outside the country to get these regenerative products, these stem cells?
I will say two things: quality and risk. So what you can get here in the United States, in Tennessee, for example, where there's guidelines saying, okay, these are the boundaries that we're going to be able to play with, that ensures that you have quality products. And that makes you having safe products. So now you don't have to be traveling all over the world with quality and safety is questionable. Now you have the stamp of an American state telling you what the boundaries are optimal for quality and risk.
At Vita Nova, I want to talk a little bit about our new longevity protocol that we have. Longevity protocol is basically a way of testing your biological age, providing some treatments that can potentially extend that biological age as well. Can you talk about a little bit about how that protocol works?
Yeah, absolutely. So one of the things that we've been able to do, going back to the ability to measure biological age objectively, is once we measure baseline where you're at, now there's interventions that we have worked with that allows you to modify that biological age in a beneficial way. So now you can have a longevity protocol of sorts that keeps you tracking down what your biological age is fundamentally, but also the ability to revert it. So this is not a static number. You're not just born with that biological age and you're fixed. You can actually take lifestyle changes, interventions that allows you to just decrease that biological age and have a healthier life.
Right. And this is not just a gimmick. This is science. This is actual research.
These are validated clocks and protocols. They have been done all over the world, and then they have a lot of scientific backup to say this is objectively a functional test that you can do to understand where you are biologically.
Right. So you can not only feel younger, but you can actually be younger.
Absolutely. 100%.
One of the questions I get asked quite a bit from my patients is, how do I know that I'm giving them the best quality cells? the best treatments possible in regenerative medicine if this is a lot of it is experimental and still being researched? How do we know this?
Well, I'll answer like my mom was talking to me and wanting to know, or a friend is wanting to know. I think the simplest answer is talk to your doctor. First of all, they're doing the right thing, talking to you about it. How do I know?
Right.
And then what I will say in terms of like the ticket item to understand is like, I want to understand my certificate of analysis. What is the COA of the cells that I'm getting? I think that's a starting point where you can bridge and interface with your physician in terms of like, what is that you're getting? That's like the ingredient list. And if someone says like, well, we don't share that, then that might be a problem because they don't want to share with you what the ingredient is. Right. That's a problem. Right. I think that's the first starting point. And I think it's important to understand that the product doesn't live without the treatment. And what I mean by that is not only what you get on a vial, is how it's administered. So the safety comes from the science, for the manufacturing, all the way to how you apply those products. So they rely on you to understand that. And then when they come to you, you should be able to talk about it. Right. And if you have a physician who is not capable to talk about it, then you probably could be in a better place like here,
right.
which you understand.
Right. Yeah, I get it. I get complaints from my staff all the time that I'm spending too much time with my patients, but it's because I'm explaining to my patients what they're getting. I want them to understand. I want them to know exactly what they're getting, how it's going to be administered, and what the potential outcomes can be, and even what can negatively happen too.
Correct.
So if they have all that knowledge and they go in with that knowledge, their outcomes are always going to be better.
So mesenchymal stem cells are just a living cell, and these cells can come from different sources, different tissues. So some takes from fat, some takes from the marrow, bone marrow, and then our understanding is the younger the stem cell, the better they can perform. And the youngest you can get ethically right now are coming from umbilical cords. That's a living cell. Stem cells are also capable of secreting a lot of factors. That's how they communicate with the body. That's how they communicate with each other. They start releasing proteins, vesicles, and if we capture all of those secretions, that's what we call the secretome. It's a rich soup of multiple factors capable of signaling other cells to behave like they should. It's like having a manager communicating with the workers through letters.
Got
it. Those are the information. Those are the letters that tell people or the workers how to behave, how to perform. Exosomes are a type of letter, or the envelope that they use for the letters.
Got it.
So exosomes are a subpopulation, or within the secretome, they're a component of it. They also transmit messages, and they are just a small group from the entire secretome. Umbilical cord MSCs are the youngest source of MSCs that we can get. They have the most powerful leverage of healing, and they do that through regulating the immune system. Now, they do that in multiple different ways, but one of them is through signals that they secrete. So those signals that they secrete, we can also collect those things, and we're able to use that as a secretome, and that's what contains the information required to control the immune system. So with that alone, we can tailor the immune system and control it in a way that is therapeutic and beneficial.
Right. And what I like about that is it doesn't completely knock out the immune system like an anti-inflammatory would, because you need some of that inflammation as part of the healing process.
Correct.
So the secretomes have the ability, and the stem cells have the ability to modulate that inflammation. So tone it down if it's too high, tone it up if you need some healing.
Perfect. So I think that's one of the main distinctions. I'm thankful. Thank you for bringing that up. So when we talk about anti-inflammatory, it's a general term, but what happens is immune modulation. And what that means is you polarize the immune system. So what I like to say is, imagine your immune system are soldiers.
Right.
These soldiers, they can be trained to hold weapons and shoot at everything and be very pro-inflammatory.
Right.
What the cells do is they take the weapons out and they give them shovels. Go build a house. Right. And you can use them in emergency to just repurpose the capability to do something useful. I've been in this industry for over 15 years, work with regenerative medicine, work with many clinics in different places all around the world. And what you have built here at Villanova is extraordinary, not only from the point of view of your knowledge and your staff, but the ability to integrate newer technologies in a responsible way. So your ability to recognize advanced therapeutics the applicability on a very safe way and being mindful of protocols that are actually going to work for your patients, and understanding that the things that might not work is something that you're not going to be doing. You're adaptable, and then you bring in the premium experience. And if there's any other place in the world that can emulate that, that will be a great success, because what I've seen compared to other clinics around the world and in the States too is most of them are trying to implement regenerative medicine as forcing the tool into their practice. And you guys have fundamentally started from that point of view. It's like, how do we can create a clinic that has that philosophy that builds on the regenerative medicine, and to not only treating a patient, but also it's like improving the quality of life overall. And that adaptability, that knowledge seeking has got you to a point where you have many advanced therapeutics that many people cannot even get access around the world. And then the oversight, well, you can walk them through and follow up and give them the access and the ability to just being treated or enhanced to the point that they can count on you and trust you for a long time.
Well, I thank you so much for all the research you're doing. I think it's amazing research, and being able to translate that into clinical practice for me has been probably the best experience in my life in doing medicine and practicing medicine, has been incorporating regenerative material to help patients heal from different conditions like back pain, autism, knee pains, and just allowing patients to continue to live a life that's functional and without as much pain.
And I thank you for being in the forefront, trying to do that for patients, but also being open into learning more and being someone who's curious enough to continue that education, because it's easy to see physicians just getting into their ways and not wanting to adapt. And then it has been extremely refreshing to see someone like you in the forefront, willing and wanting to learn and adapt to serve your patients better.
Well, thank you. I appreciate that.